Corridors and patients waiting on trolleys usually hits the headlines in the winter months, but overcrowding isn't just a symptom of the bad weather. As the INMO said today that last month has been the worst March on record, with more than 9,000 patients waiting on trolleys to be admitted, an increase, it says, of 5% on the same period last year.
The crisis deepens, the inadequate bed supply is coming back to haunt us, the running down of community services is coming back to haunt us, and the shortage of staff is coming back to haunt us. And the losers are patients who are very sick and frail and frontline staff who can't cope.
INMO figures show 525 patients are waiting on trolleys around the country today, with St Vincent's University Hospital in Limerick, Our Lady of Lourdes in Drogheda and Beaumont the worst affected. And consultants group say this continued trend is detrimental to patients.
The international evidence suggests that for a population of the size of Ireland, then somewhere between 350 and 360 patients per year die that wouldn't otherwise die as a direct result of emergency department overcrowding.
Both the HSE and the Department of Health dispute the INMO's figures, saying that overall there's been a 2% drop in the total number of patients on trolleys, despite a spike in demand and an increase in the number of patients over 65. Derek O'Reilly's 74-year-old father is one of those. He's waiting in St Vincent's Hospital today.
He collapsed on Saturday. He was in the doctors this morning and they said it could have been a mild heart attack. So they referred him up to Vincent's here. We've been here about 45-50 minutes for him to be registered, which I personally think is too long, just for registration. So we don't know how long we're going to be waiting now.
Nurses and consultants groups are now calling on whoever the next government is to make hospital overcrowding a priority. Laura Hogan, TV3 News.